53-year-old man is brought to the emergency department because of wheezing and shortness of breath. That has begun 1 hour after he took a new medication earlier. This day he was diagnosed with stable angina pectoris and prescribed a drug that irreversibly inhibits cyclooxygenase 1 and 2. What is the drug again? Aspirin. He has chronic rhinosinusitis and asthma treated with inhaled beta-adrenergic agonists and corticosteroids. Respiratory rate is 26 per minute, that is increased. There are multiple small erythematous nasal mucosal lesions. After the patient is stabilized, therapy for primary prevention of coronary artery disease should be switched to which of the drugs? What is the mechanism of action of the drug? So this is a second order question. So you have to know to which drug they have switched from aspirin, right? Aspirin allergy is there. So due to that contraindication of usage of aspirin, which is the most next appropriate drug to be used? You have to know the drug and mechanism of action of the drug, of that drug. So I'm gonna go with B. Platelet physiology is very important. Now, okay, if we read the question, after patient is stabilized, therapy for primary prevention of coronary artery disease should be switched to which of the following drugs? I told you they were giving aspirin first. Now they have switched to some other drug, that is clopidogrel. Right? Clopidogrel, the mechanism of action is it inhibits ADP receptor. ADP receptor is also called as P2Y12 receptor, which is present on the platelet. Quickly, I will tell how the platelet adhesion and aggregation happens. This is the subendothelial collagen. What is the factor present which is exposed when there is a breaching of subendothelial collagen? What is the factor which is produced by the Weber palette bodies and alpha granules of platelets? What is exposed here on the subendothelial collagen? What's the factor known as? It's called as von Willebrand factor, right? It is produced by Weber palette bodies and alpha granules of platelets. Okay, so this is the factor which is exposed from the subendothelial complex. This is the von Willebrand factor, which attaches to the GP1B of the platelet. This is the platelet. It goes and attaches to the platelet. This is called as platelet adhesion. First, platelet plug formation is adhesion. Second is aggregation. How does aggregation occur? Now, when the addition occurs from platelet to von Willebrand factor, there is conformational change. There is change in the shape of the platelets. Okay. There is change in the shape of the platelets. What happens is the platelets starts releasing calcium, ADP, thromboxane A2. All these are activators of platelet aggregation. Okay. Now this ADP goes and attaches to the ADP receptor, which we were talking about right now, right? This ADP goes and sits here. What this ADP does is, now what the activation of this causes formation of another receptor, which is called as GP2B3A. You guys know this, right? Now this calls other platelet friends, and then attaches with fibrinogen and fibrin. Okay, this is how platelet aggregation occurs. There is GP1A, there is GP2B3A, and all the platelets come and aggregate. This forms a platelet plug. So this is how a platelet plug is formed. If you inhibit the receptor, ADP receptor, clopidogrel, by giving clopidogrel, If you inhibit this, platelet aggregation won't be there. Platelet aggregation won't be there, so you won't form thrombus. You won't form thrombus, it won't go to embolus. That's the main motto of giving clopidogrel, right?
Thanks for watching. Please give a thumbs up and subscribe for more.